Good morning. Welcome to the Mountain Morning Show. It is the 28th of March, Tuesday.
Yes.
Good morning.
Welcome
Eliza
back.
Morris, thank you.
Welcome back, Joe Davis.
Happy to be back, kind of.
Kind of, from vacation.
I was in Moab, and I got to be honest, you know how hard that is to leave. It was pretty great.
Well, it sounds beautiful.
Yeah.
But we are thrilled that you were back, and of course that you all are joining us on the Mountain Morning Show live right here on Park City Television. And today we're going to kick off the show with something a little bit different.
Yeah, it's Multiple Sclerosis Awareness Month, and as such, we're going to get some info, some insight into the disease, and we're really excited because we have calling right from the Mayo Clinic, who we've always wanted to talk to these guys.
Yes.
Dr. Mark Keegan is on the phone, and he's going to talk to us about the disease and some of the things that they're working on as well, and some of the pitfalls that come along with this. There's a lot of famous people who've had multiple sclerosis.
Well, I think it's becoming more and more prevalent.
Yeah,
people are a
we're
little
seeing
bit
it
more
more
aware of it, but unfortunately it's one of those diseases right now where there is no cure.
Right.
So right now it's about early detection, it's about how it's treated, and we're thrilled to have literally the expert on the subject live on the show. Good morning, Dr. Keegan.
Good morning. Thanks for having me on the show.
Thank you for joining us, sir. It's great to have you. We've got obviously lots of questions, but first, could you give us a little background?
Sure, I can give you a background on multiple sclerosis. Multiple sclerosis is an autoimmune disease of the central nervous system. And what that means is an autoimmune disease is the body's own immune system, meaning the lymphocytes or white blood cells that usually protect us against infections, attacks the myelin sheath, which is the coating of the nerves in the brain and the spinal cord, as well as the optic nerves, for uncertain reasons. But that's what multiple sclerosis is an immune-mediated attack from the body's own immune system against the brain and spinal cord and optic nerve.
And does it seem like it's becoming more and more prevalent as the years go on? I know that we're nowhere near where we can say there's a cure. What about cause?
Well, it does look like it's becoming slightly more prevalent in women than it has been in the past. It's not a rare condition. About 400 or more thousand people have multiple sclerosis in the United States, so it's not a rare condition. The other thing about MS is because it's a chronic condition, if life expectancy is reduced, it's only by a few years. So most patients with multiple sclerosis do have it for many decades. That's why most of us know someone with MS, or at least have heard of it. There are a number of medications now available that treat relapsing forms of multiple sclerosis. In fact, there's about 15 FDA-approved medications that we have, and they range from injectable medications to oral medications given by mouth, as well as infusion-based medications that are given intravenously on a regular basis. So we do have excellent treatments for patients with multiple sclerosis.
Now, you've written a book. It's called the Common Pitfalls in Multiple Sclerosis and CNS Demyelinating Diseases. Talk to me about that book and what the research is that you're doing. As I understand it, part of this research is translational. Explain what that entails.
Well, that's right. So the book that I've written really takes cases that we've seen here at Mayo Clinic, presents them in a fashion that physicians and other neurologists would be able to read them and understand different presentations of multiple sclerosis, as well as immune diseases that aren't multiple sclerosis that may act as mimics for multiple sclerosis, meaning they look like multiple sclerosis, but they're actually from a different cause. And so that book is mostly aimed at physicians, although patients could find some interesting material to read in there as well. In terms of research that we do at Mayo Clinic, I'm involved in clinically based research and, like you mentioned, translationally based research. Translational research means taking things that we've learned in the lab and directly applying them to patient care. At Mayo Clinic, that's the most important thing, is translating any type of research that we develop directly into immediate care for the patients and how to help them through multiple sclerosis. So we're investigating therapies for multiple sclerosis and related conditions, as well as different clinical presentations of multiple sclerosis and diseases that may mimic multiple sclerosis.
And Dr. Keegan, so many diseases, early detection can really be a huge factor in the care of the patient. What are some of the early symptoms or signs that people could look for or notice with MS?
Well, that's right. There are a few characteristic symptoms that people may develop with multiple sclerosis. And I'll give an example. One is optic neuritis. That's a common symptom of multiple sclerosis. And what happens with that is there's inflammation of one of the optic nerves, which is the nerve that goes from the eye back into the brain. And they'll present with loss of vision, particularly central vision, often with some pain or discomfort of the eye. And one of the important things is it would progress over a number of hours or days. It usually stays for days to weeks, and they may improve by itself over time. The inflammation, the pain will resolve, and the vision may get back to normal. If the brain or the spinal cord is affected by the inflammation, you may get weakness or numbness involving one side of the body or the other side, or even, in fact, both legs all the way up to the arms with spinal cord inflammation. And again, a key is progression of those symptoms over a number of hours to days. They always have to last at least 24 hours, but usually many days to weeks over time. And then improvement spontaneously after that is very typical of a relapse of multiple sclerosis.
We know the Mayo Clinic is, cutting edge as far as the research and applying that research, as you said, translationally. With that being said, are there regulations that are still getting in the way of you guys taking some of those things that you've learned and applying them immediately, or are you able to, do some things that otherwise we may not be able to see until years of study and testing and what have you?
Well, I think it's true that drug development does take a lot of time. It's important for a number of reasons. First of all, you have to demonstrate that it could be effective in animal models and other models. Then you have to show that it's safe in humans. That takes a lot of time. And then MS therapies usually are examined in studies that have hundreds and sometimes up to 1,000 patients in different groups. They should be shown to be effective against no medication, or what we call a placebo medication. And they often now have to be proven against medications that we already know are effective for multiple sclerosis. So that does take time and a lot of cost to prove those medications. I think the FDA is very good at trying to fast track medications when there is a great need, which there is in multiple sclerosis. But that does take some time. I think they have been very successful, though. As I mentioned, there's about 15 FDA-approved medications for multiple sclerosis, and the first one was approved back in 1993. So that's not a lot of time to have that many medications for a disease where we had no other treatments before.
Well, Dr. Keegan, like you said, so many people now know somebody that has this disease and it's affected somebody in their family or a close loved one. If people want to learn more and maybe even donate to some research and get involved in the work you're doing, where can they learn more information?
Well, we have access on mayoclinic.org for both education, philanthropic donations to Mayo Clinic. Another place to get educational information and to donate is the National Multiple Sclerosis Society, and their website is nmss.org. I think those are two great sites that people can investigate.
All right, Dr. Mark Keegan, thank you so very much for joining us from the Mayo Clinic. Great information about multiple sclerosis, as this is the Multiple Sclerosis Awareness Month. Yeah, really appreciate you joining us and giving us some great information. Thank you so very much for that. Have a great day.
Great, happy to be here. Thanks very much.
Well, one hopes that we continue to progress in this area because, as you may, I mean, I don't know how you could miss all of the telethons when you were a kid growing up, working towards raising money for this and funding for research. Of course, that funding need still goes on. There's always a way for you to be involved in that as well. So you can check out more at the Mayo Clinic's website as well. Multiple sclerosis.
Well, I think, like you said, so many people now know somebody that this affects their lives, and you know, a hereditary disease, or if there's some fear there because it's one of those unfortunate circumstances where there isn't a cure yet. So to be able to talk to somebody on the cutting edge is exciting.
Well, the Mayo Clinic, that's great. Yeah, you couldn't get any more cutting edge than that.
No.
We've got a lot more coming up here on the Mountain Morning Show. We, of course, to make room for that, we've got some news. We've got to tell you what else is on the show, and we've got to look outside in your weather. All of that coming your way in just moments here on the Mountain Morning Show. We will be right back.